Mr. Lee, a 67-year-old man, presented to the emergency department with worsening abdominal pain, distension, and inability to pass flatus for the past day. He reported feeling intermittently bloated over the past few months, but no previous episodes this severe. His past medical history was significant for coronary artery disease, hypertension, and benign prostatic hyperplasia. On exam, he was afebrile but in significant distress due to pain. His abdomen was distended with high-pitched bowl sounds. A large irreducible epigastric hernia was noted. Laboratory studies were unremarkable aside from a leukocytosis of 12,000/mKl. CT of the abdomen showed dilated small bowel loops with air fluid levels and an incarcerated ventral hernia containing non-ischemic bowel. The patient was made NPO, given IV fluids and analgesia, and started on antibiotics. General surgery took the patient for urgent laparoscopic epigastric hernia repair with reduction of the hernia contents and mesh reinforcement. He tolerated the procedure well without complications. Post-operatively, his pain improved and bowel function returned. He was advanced slowly to a regular diet and discharged home on post-operative day 4 once he was tolerating food and ambulating. He was instructed to avoid heavy lifting and strenuous activity for 6 weeks to allow adequate healing. Commentary questions. What are the risk factors for epigastric hernias? Obesity, prior abdominal surgeries, smoking, collagen vascular disease, ascites, peritoneal dialysis, family history, and conditions that increase intra-abdominal pressure. How does an incarcerated hernia differ from a strangulated hernia? Incarcerated contents are trapped but maintain blood supply. Strangulated contents have compromised blood flow leading to ischemia. What is the role of urgent/emergent surgery in managing incarcerated hernias? Urgent reduction of incarcerated contents can prevent progression to strangulation and bowel necrosis. Delay increases risk of complications. What are the pros and cons of an open versus laparoscopic approach for hernia repair? Laparoscopic has faster recovery but higher recurrence rate. Open has longer recovery but lower recurrence rate. Laparoscopic allows for easier mesh placement in some cases. What postoperative care is important after hernia repair? Pain control, activity modification to allow healing, watch for signs of infection, follow up to ensure no recurrence, avoid constipation and heavy lifting, report concerning symptoms promptly.